Welcome to the Nutrition Club. This week, we will be talking about diabetes. What exactly is diabetes? Diabetes mellitus, which is the scientific term, is a disease where an individual experiences high blood glucose levels caused by the inability to either produce insulin, react to insulin, or even both. According to the Center for Disease Control and Prevention, also known as the CDC, there are more than 34 million Americans that have diabetes, and that 1 in 5 don't even know it. 2 in 5 Americans are expected to have type 2 diabetes in their lifetime. Out of 88 million American adults, more than 1 in 3 of them have prediabetes. In 2017, $327 billion was spent in the US due just to diabetes. Medical costs are twice as high for those with diabetes than those without it. A significant amount of research today is being done throughout the country just trying to lower all of these statistics. There are actually a few different types of diabetes. So 5 to 10% of the people that are diagnosed with diabetes have type 1 diabetes. This form of diabetes cannot be prevented. It is when the pancreas makes little to no insulin. The most common form is type 2 diabetes, which usually develops slowly over time. It is when the pancreas does not make enough insulin or the body doesn't properly use the insulin. Now, prediabetes is when an individual has blood sugar levels that are higher than normal, but not high enough to be considered type 2 diabetes. And lastly, gestational diabetes. This is when the body doesn't produce insulin during pregnancy. What is insulin, and what does it have to do with diabetes? It is a hormone that is produced in the pancreas. It acts as a key to unlock and open the door for blood sugar, also known as glucose, to be able to enter the cell. Now, these cells in our body use the glucose to create energy for all of our bodily organs to be able to function. There are some common symptoms that are known to be experienced by people with diabetes, such as blurry vision, cuts that take longer than usual to be able to clot, inconsistent hunger cues, like being hungry when you really should be full, experiencing excessive thirst, frequent urination, and even tingling and numbness in the hands and feet. Not everyone with diabetes will experience all of these symptoms. Just having diabetes can actually increase other health risks, such as developing blindness, heart disease, a stroke, kidneys failing, and even the loss of toes, feet, or legs. The risk of early death for adults with diabetes is 60% higher than those without diabetes. You could develop type 2 diabetes if you have a family history of diabetes, are 45 or older, have had a pregnancy with gestational diabetes, are overweight or obese, if you're not physically active, or if you currently have prediabetes. There are some ways of preventing type 2 diabetes. Firstly, by eating nutrient-dense foods, having healthy weight loss, and being more physically active. If you already have prediabetes, losing weight by eating healthy and being more active, it can cut your risk of getting type 2 diabetes in half. Here are 7 ways you can manage diabetes through nutrition. At meal times, try to fill half of your plate with fruits and non-starchy vegetables. 2, choose healthy carbohydrates such as fiber-rich whole grains and even starchy vegetables like potatoes and corn. Try to eat less fats by choosing lean proteins like poultry, eggs, fish, and beans. Use healthier fats such as avocado instead of margarine. And try cooking with things like coconut or olive oil instead of vegetable oil. 4, create a consistent meal routine based on your personal lifestyle and times you're usually hungry throughout the day. Cut down on table salt. According to the Food and Drug Administration, more than 70% of sodium in the average American diet comes from packaged and processed foods. Try cooking at home more and season your foods with herbs and dried spices instead, and even choosing more fresh produce. 6, be mindful of your portion sizes, especially when it comes to carbohydrates. Try eating slowly and listening to your body's hunger cues. And lastly, 7, remember to focus on your food. Avoid eating in front of TVs and computer screens and mindlessly eating in the car. Take the time to sit down at the table each meal and enjoy your food. All right, club members, if you haven't done so already, make sure to follow us on Instagram for little tips and tricks and some sneak peeks into your upcoming food bags. If you have any kind of questions about the club or your food bags, please feel free to give us an email. You can also email us with any kind of culinary questions. Now, please remember to wash your blue food bags and return them at your next pickup day. And don't forget to subscribe to our YouTube channel. This way you can learn some new and healthy cooking skills to use in your kitchen. Would you like to become a member of the Nutrition Club? See if you qualify. Do you have difficulty putting food on the table? Do you have Fallon health insurance? Do you have high blood sugar levels and know if you have an A1C greater than or equal to 7? Or are you a pregnant or a postpartum woman? If these apply to you, contact us. Each individual's health is unique. If you have any questions about your diabetes or risk of diabetes, please contact your doctor. If you would like more guidance with your diet intake, ask your doctor for a referral to see a dietitian. We have dietitians here at CHP that may be able to help you. The Nutrition Club is funded by Fallon Health Insurance, works with Berkshire Health Systems, and is provided by Community Health Program.